I'll be right back.
Okay, Grace. Okay, we've got 1 more minute and we're recording.
Sometimes we give it a couple extra minutes in case people.
Hi, my name is Veronica Dees Hodge. I am the commissioner for the City of Pleasant Hill Commission on Aging group. We hold various events through the Pleasant Hill Senior Center, and they're basically all health orientated, and there are some financial presentations that we do as well. I deal with primarily the cognitive, that means the memory-based issues, because that's my area in mental health. So I'd like to introduce the forum. We have Gene Giramonte. He will be leading the presentation, and then we have Miss Grace Liu. She is one of the persons over at the Lafayette Alzheimer's Association group, and she and her and Jean will be leading this event, and I'll just be sitting to the side enjoying the event. So in terms of Zoom etiquette, I'd like for everyone to please put themselves on mute. If you have a question, as Jean is going through the series of the presentation, I ask that you please hold the questions, because there will be like a mini break in between. If it's a situation where you do not want to hold the question because you feel like you might forget, if you look on the bottom of your screen, you will see reactions. You can either raise your hand or clap or put thumbs up if you're in agreement with something that he's saying. At the end of the presentation, we're going to have a segment for questions. So please, again, if you cannot wait until he takes the break and asks, well, is there something that you like to respond to, then use the icons at the bottom where it says reactions to, and he will address it for you. So now I am going to turn it over to Jean, and here we go. Thank everybody for attending.
Thank you, Veronica. It's a pleasure to be with everyone today. And Holly, thank you for helping to host this program. Again, my name is Gene Giramonte. I am currently a volunteer community educator with the Alzheimer's Association, and I'm connected primarily to the Northern California, Northern Nevada chapter of the association, and particularly I'm in the North Bay. I live in Santa Rosa, where I'm zoomed in right now. And my connection to the Alzheimer's Association and to the disease of dementia is that my late husband of 33 years was diagnosed with both Alzheimer's dementia and vascular dementia in 2011, and he passed away in 2018. And during that time, I was his primary caregiver, along with a lot of help that I ultimately figured out I needed a little later than I should have waited, but that happens. I was also working a full-time job at the time, so it was a very challenging situation. And the Alzheimer's Association was there to provide a lot of support to us and resources that we could tap into and so forth. So that is how I became closely associated with a terrific organization that they are, and decided after my retirement to give back my time and whatever talent I have to do things like this and help others. So what I'm going to do right now is share my screen and make sure everybody can be able to view my slides. So hopefully you can all see that.
Yes.
I see Veronica nodding, so that's good. So this program is presented by the Alzheimer's Association. It is designed for those who want to learn more about the warning signs of Alzheimer's and other dementias, and those who have noticed memory or thinking changes either in themselves or others. So if anybody's comfortable at this point before we actually begin, and you would like to share why you're here today. If you're comfortable doing that, I would say you could unmute yourself and tell why you came here today, whether it's because you're noticing signs either in yourself or someone close to you, or you just want to be more informed. So I'll take a second here if anybody wants to share anything. Okay, then let's go ahead and proceed. And please be sure, we will be playing some video clips from experts in the field and those living with the disease. So I want to make sure if you can't view or see those, that you enter a note in the chat or raise your hand or let us know in case there's a problem, but I think we'll be fine. So let's take a look at what we're going to be discussing today and what you should be able to know by the end of this session. And let me get my other screen here. So we're going to explore the most common warning signs of Alzheimer's to help you be informed about what is normal aging versus what is not. And these are the items that you will be better informed about by the end of this program. So be able to describe the typical age-related memory, thinking, or behavior changes versus those that are connected to an actual dementia diagnosis. And we'll talk about those warning signs. We'll talk about how to approach people who may have memory concerns. We'll talk about early detection and the benefits of an early diagnosis of the condition, which is possible, you'll find out. And we'll talk about the tests and assessments that are involved in getting to a diagnosis. And finally, we'll discuss the resources that are available through the Alzheimer's Association. Now, throughout today's presentation, we're going to periodically check in with the Garcias. The Garcias are a fictitious family, and we'll be following along as Mary's daughters discuss their mother's memory changes and take action to find the cause. Now, please note that the Garcias' experience might be common, but it does not represent the exact experience for everyone, as situations vary from person to person. So Mary is a 73-year-old widow who lives alone. She's a retired school teacher. She's always meticulously cared for her home. Her daughter has recently noticed laundry piling up, mail and newspapers scattered around the house. So Lydia here is her eldest daughter of her two daughters. She lives just a few miles away from her mom and visits her frequently. Patricia, on the other hand, lives in another state. She works long hours and she's unable to visit her mother frequently. So she communicates with Mary and Lydia frequently via phone and text messaging. Now, Lydia is concerned about their mother's noticeable lack of tidiness and that she is continuously losing things. So she reaches out to her sister, Patricia. So let's see what the conversation. So Lydia is clearly, she's worried about her mom, their mom. She's discussed with Lydia or Patricia, you know, how she's losing things and the house is a mess. And Patricia says, well, it's probably normal to get a little forgetful with age. Patricia says, it's so unlike her though, should we worry? And Patricia says, well, let's reach out to our old neighbor, Dr. Salloway. Now, I want to point out that although this is a fictitious scenario, Dr. Stephen Salloway is, in fact, a real medical doctor who has been recognized as a leading expert in aging and Alzheimer's disease and other memory disorders. So let's hear what Dr. Salloway says.
As we get older, cognitive problems become more noticeable for almost everybody, and it can vary from person to person. Typically with age, people have trouble coming up with the word they want right when they want it. They have trouble remembering names and they don't think quite as quickly. What's more concerning, or what might be the beginning of a memory problem, is people have a lot of trouble coming up with words or names, and it's happening more frequently, and the words or names don't necessarily come to them later. And then they start misplacing things, but not just once in a while, because we all misplace things, but more often. And it begins to interfere day to day. That should be a warning sign for people that this might be the beginning of a memory problem.
So, Veronica, I'm assuming everybody's hearing that video okay?
Oh, yes.
Okay,
Yes.
great.
Thank you.
So we're all here today to learn more about dementia and Alzheimer's and identify common warning signs of the disease. You may have heard the term dementia and Alzheimer's used interchangeably. While they are related, there are significant differences between the two. So we're going to hear more about this from some dementia and association experts. Now, first, Dr. Heather Snyder is going to discuss what dementia is.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow and the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
So Alzheimer's is the most common form of dementia, accounting for more than 80% of all cases. Now, next, Dr. Dean Hartley is going to explain to us what the disease is and what it looks like in the brain.
More than 100 years ago, Dr. Alice Alzheimer's described specific changes in the brain, what we call the formation of plaques and tangles. Now, Alzheimer's is a progressive brain disease that's marked by these key changes and is thought to impact memory, thinking, and behavior. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. The cerebrum fills up most of your skull. It is part of the brain most involved in remembering, problem solving, thinking, and even feelings. There are about 100 billion nerve cells, or neurons, throughout the brain that transmit messages in order for us to create memories, feelings, and thoughts. Alzheimer's disease causes nerve cells to die, which leads to the brain tissue loss, or what we call shrinkage, and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's disease, such as memory loss, problems with thinking, planning, behavioral issues, and even at the end stages, problems with swallowing.
Lastly, we'll hear from Ruth Drew, who is the Director of Information and Support Services at the Alzheimer's Association. She'll be talking about the importance of recognizing the warning signs of Alzheimer's.
It's important to know what the warning signs of Alzheimer's are and to be on the lookout. We know that we change over time, and the warning signs of Alzheimer's can be warning signs of a number of things, but when you see those in yourself or in someone you care about, it's important to check it out, to consult with a doctor, to find out what you're dealing with.
As Ruth said, it's important to know what the warning signs are. Ooh. Sorry about that, something's ringing here. I'm sorry. Hang on, I can't get to that space. I guess my phone was attached to the computer. Sorry about that. Let me get back to what I was saying. As Ruth Drew just said, it's important to know what the warning signs are and to be on the lookout for these marked changes. The Alzheimer's Association, as a leader in this area, has developed a list of 10 warning signs to help people understand the difference between normal aging and common signs of possible dementia. Now, this list is intended to be a tool to help identify unusual changes in a person's memory, thinking, or behavior. It's important to note that this list does not constitute a diagnosis of Alzheimer's or dementia. These are simply the most common examples of changes experienced. Individuals may experience one or more of these signs in different degrees. So let's explore each sign and what some typical age-related changes may be. So first of all, memory loss that disrupts daily life. One of the most common signs of Alzheimer's, especially early on, is forgetting recently learned information. Others include forgetting important dates or events, repeatedly asking the same questions, and increasingly relying on memory aids or leaning on others for things or tasks once handled on their own. Now, a typical age-related change, a normal age-related change, is sometimes forgetting information but remembering it later. Our second identified sign, challenges in planning or solving problems. Some people may experience new difficulties in executive functioning, including developing or following a plan, or difficulty concentrating. Conversely, a more typical age-related change is making occasional errors when managing bills or household finances, for example. Let's hear from John, who is living with dementia with Lewy bodies, about how he experienced this early warning sign.
I was probably spending 4 to 5 times more time preparing for something than I did, say, 5 or 10 years ago, because of I would lose my thought, I'd lose my focus, I'd get anxious, I wouldn't get to sleep. I was thinking of this, I was in my sleep, I was thinking about what I was anxious about, which was I was trying to remember, which was I was trying to prepare, which I was trying to do. So it was really a vicious circle of, so I was able to control it a lot, so that people wouldn't see things, and that there weren't things to be seen. It's what was disturbing me was what effort I had to put into to do the things I used to do more easily.
Now, third is difficulty completing familiar tasks. People living with dementia often find it hard to complete daily tasks that used to be managed with ease, such as driving to a familiar place or writing a grocery list, remembering how to play a favorite game. Conversely, a typical age-related change would be occasionally needing help to use a microwave or a remote control. This could also include having trouble with new technology that the person hasn't had the opportunity to engage with as frequently. Let's hear a little more about this from our association expert.
Some people have difficulty with math or with reading in a way that's unusual to them. And once again, this is a change in that person. So for example, we all know somebody who was never able to balance their checkbook, right? So that wouldn't be a warning sign for them. But if somebody who always balanced their checkbook to the penny suddenly was paying bills, the same bill over and over, and not able to balance their finances, well, that would be a sign for them.
Fourth, excuse me, clicked too fast there. Our fourth sign is confusion with time or place. An individual living with Alzheimer's or another dementia may lose track of dates, seasons, or the passage of time. They may have trouble understanding something if it's not currently happening, or become confused about where they are or how they got there. This can become more dramatic or profound in the middle and late stages of the disease. Now, again, a more typical age-related change could be getting confused about what day it is or when a scheduled appointment is, but figuring it out later. Fifth, trouble understanding visual images and spatial relationships. Some individuals with Alzheimer's or another dementia may experience vision problems, which can lead to difficulty with balance, trouble reading, and problems judging distance and determining color and contrast, which can all impact driving or navigating the environment around them. Vision changes, such as cataracts, are a more typical age-related change. This sign shows us that these changes are not just about memory. It's important to think about all of the other ways that someone's daily life may be impacted by any of these changes. In my experience with Art, my late husband, this was particularly noticeable as he progressed through the disease. Things like just sitting at the dinner table, he would reach perhaps for a salt shaker and he would miss it by 6 inches, which I found, very unusual, obviously. Or he'd put a glass of water on the very edge of the corner of the table where it was likely to be knocked over quickly. And driving had to cease as well. So we'll listen to our expert here talk a little more about this.
Alzheimer's disease is not just a disease of memory. It can affect other things too. It can affect the way that we perceive what we see. So sometimes somebody in the early stages of Alzheimer's might go to the eye doctor because they're having trouble seeing, and in fact their vision is just fine, but the way they're perceiving what they're seeing may be difficult.
Number 6. New problems with words in speaking or writing. Individuals may have trouble following or joining a conversation, stop in the middle of a conversation and forget what they were talking about, and continuously repeat themselves. They might also struggle with finding the right word or calling things by the wrong name. They may start using more descriptive terms to talk about something rather than the actual name of the item. For example, a wristwatch might become an arm clock or something like that. It's whatever words they can bring forth to describe what it is they can't remember. A normal age-related change, however, would be occasionally having trouble finding the right word. That happens to all of us. That's not unusual. When it's a pattern and a repetitive thing, that's when it becomes noticeable. Let's hear from Phil, who is living with Alzheimer's, about this particular warning sign.
The other thing that I've increasingly been struggling with are words, which I've dealt with words my entire life, as an avid reader, as a reporter, as a writer. I struggle with them now.
Our 7th sign, misplacing things and losing the ability to retrace steps. This sign often causes concerns in people. I'd like to clarify that this is not about just losing your keys on occasion. Misplacing things from time to time, but retracing steps to find them is a normal age-related change. A person with Alzheimer's disease may lose things and not be able to recall when it was last seen or identify the location where it was placed, or he or she may not, they may put things in unusual places, such as putting a pair of shoes in the refrigerator. Now, because of the lack of executive function and awareness, the person may grow increasingly suspicious of others and start accusing others of stealing, and do so more frequently over time. Let's hear from Ruth Drew again to explain this sign a little further.
So some people wonder if they lose their keys or their glasses or their purse, is that a sign of Alzheimer's? And one thing that I would say about that is for most of us, we might misplace something, but then if we retrace our steps, we can usually find it. We can usually remember. For a person with Alzheimer's, sometimes they're not able to retrace their steps. Sometimes that memory is just gone. And so when they do find their keys next to the phone because they got interrupted by a phone call when they were coming in and they set their keys down in an unusual space, so there they are next to the phone. If that happened to you or me, we'd probably remember, oh yeah, the phone was ringing when I came in the door. I put down my keys. The person with Alzheimer's might not remember. They might wonder who's moving their keys around because they never put their keys by the phone. So that's just a little bit of a difference in some of the dynamics with losing things in Alzheimer's.
Number 8, decreased or poor judgment. Individuals may experience changes in judgment or decision-making, such as using poor judgment when dealing with money or paying less attention to hygiene and grooming. This can be especially common in individuals who live alone. Making a bad decision once in a while, such as forgetting to get an oil change, is a more typical age-related change. Again, an example I can give in my situation is that because I was still working and Art was retired during the time that he developed Alzheimer's disease, he had always been responsible for maintaining the household bills and doing the things around the house because I was at work. And I began to see and get calls that our bills were not getting paid, or we were getting second ding notices. And I saw Art one day going through the mail, and most of it he was just tossing into the junk mail bag instead of opening it and realizing that it was an important piece of mail. So that's an example of how judgment begins to be compromised in these situations. Let's hear from Teresa how she experienced it.
The way I kept my house, I wouldn't say I was OCD, but pretty close to it. And all of a sudden, everything was okay with me. It's like, oh, it's a pile, I'm tired. So my dining room table usually looked like it was someone's office, because I always would say I would do it tomorrow. And then my bedroom, as far as clothing, I would just put it in a corner, put it in a chair. And all of this is just, I wouldn't say it looked like I was a pet wreck, but really I was, because I never threw anything away. I always would say, I'll get to it, but I never did get to it. So just the way of my standard of living, it was actually decreasing.
Our 9th sign, withdrawal from work or social activities. As we age, it's normal to feel uninterested by family or social engagements at times. However, someone who is experiencing dementia-related changes may start to lose their ability to hold or follow a conversation. And as a result, they begin withdrawing from social encounters or hobbies. They may lose the confidence to engage in that way. Let's hear again from Dr. Salloway.
One of the most common changes, and early on, is the person's comfort zone shrinks a little bit, and then that gets worse throughout the course of the illness. So they're less comfortable going out, they're less motivated to do things than they were in the past. So there's some change in day-to-day functioning that way. I think people also lose confidence in their cognitive abilities, because they may not recognize someone or know their name or find the right word, and they'll feel awkward, and they don't want people to notice that, so they feel more comfortable at home or in situations with family where they're very, very comfortable with that wouldn't concern them. So people tend to withdraw a little bit and be less outgoing. That's can be one of the early signs of Alzheimer's.
And our 10th sign is changes in mood and personality. Individuals with Alzheimer's or another dementia may become confused or suspicious, depressed, fearful, or anxious. They might get easily upset, either at home or when out of their comfort zone. As we age, however, it's normal to develop very specific ways of doing things and becoming upset or irritable when our routine is disrupted. Someone with Alzheimer's or dementia may become fearful, angry, or easily frustrated, which is something that should be addressed. Dr. Salloway is going to share a little more here.
Another early sign of Alzheimer's or dementia is subtle changes in behavior. So all of a sudden, the family may notice the person is more easily irritated, or more impatient, or a little moody, or have a shorter fuse, or more anxious. Now, there's lots of things that can cause that, but often that can be an early symptom of Alzheimer's or go along with the early symptoms of memory loss.
Let's check in with the Garcias again, and then in a few minutes, we'll take a quick break for questions so far. But as we talked about earlier, Mary's daughters are concerned about the changes they're observing in their mom, and they want to know when it's time to see a doctor about the changes they've witnessed. So let's take a look at their conversation. So the two sisters are exchanging information about the warning signs and what they're noticing, and how do they know if it's appropriate to see the doctor? So they reach out to Dr. Salloway.
Memory is not all or none, especially when there are early symptoms or signs. So on a good day, people might function very well and no one notices there's a memory problem. But on other days, especially if they're tired, then things become more noticeable. So memory is variable. It's not all or none. And then there are different type of symptoms that develop for each person. So some people may have trouble with language, may have trouble with organizing themselves, may have trouble navigating while driving, and other people don't have the same symptoms. So you don't have to have every symptom of Alzheimer's to be concerned. And I think the most important thing is determining what has changed from that person's normal level of functioning. And usually people have a pretty keen sense of what they can normally do well. And then when either they or the family notice that there has been some change from that usual pattern of functioning, that should be a warning sign to people. But they don't have to check off all the boxes.
So Dr. Salloway just gave us a great recap. It's important to remember that these warning signs are intended to be a guide to help identify problems in memory, thinking, or behavior that may be related to Alzheimer's or another dementia. Individuals may experience one, all, or some of these signs in varying degrees and in numerous or single occurrences. They do not have to experience them all for there to be a concern. And it's important to discuss any change in memory, thinking, or behavior in either yourself or someone else with your doctor. So our next topic is going to be the importance of early detection of the disease, but I'll break here in case, Veronica, if there are any questions popping up, either in chat or if anybody wants to unmute.
There are no questions in chat, but I welcome the attendees to please share your concerns, your questions, or experiences with yourself or family members or friends.
I have a question.
Yes.
I have a question here. I went to a conference many years ago, and they told me that one of the early signs was the losing your smell.
That has been documented. I don't know I can't recite any specific research or facts, but I have read that is a possible sign, yes. In fact, after the fact, I learned that might have explained my late husband's loss of sense of smell. Although his loss of sense of smell occurred several years prior to the diagnosis of dementia, but we all know that a diagnosis usually comes well after the disease has started. In fact, there may be some evidence that the precursors of the disease start well before a diagnosis. So that is a possibility. I can't give you specific information on that, but if you want to pursue that further, I'd be happy to do that.
Also, my second question, how do you tell a friend that she needs to go to a doctor? Because I have been noticing it, the behavior, the pattern, but I'm not a doctor. How do you approach this nicely for this person to look for help? Thank you.
Well, that's a great lead-in because our next topic is going to address how do you approach someone and how do you have that conversation and get them to the doctor. So that's a very timely question. Thank you.
Are there any other questions or comments before we move forward, please? Okay. We'll have time at the end as well, and I'll break after a couple of other modules here. So we'll get to your questions as they arise. Again, this topic now is the early detection, and it's key that we pay attention to what's going on with our own cognitive health and not dismiss any changes that we may be experiencing as normal aging, as well as that of others around us. Any change that's unusual for your level of functioning or that of someone around you is cause for concern. Many times, friends and family are the first to notice changes in someone's memory, behavior, or other abilities. In this module, we will discuss why it's critical to address any observed changes early and seek answers from a medical professional. Sometimes the person exhibiting symptoms isn't aware or may not have the insight to know that they are experiencing changes, which is why having outside perspective is critical. This is especially important for individuals who live alone or are far from family and friends. Let's listen as Dr. Salloway discusses this and then hear from a care partner who was the first to notice changes in her husband.
You know, it's a very interesting phenomenon that people who have memory problems are often less aware of it than family members or their friends who know them well. One of the reasons for that is our ability to monitor ourselves, which is an important part of brain function, decreases when we start having memory problems. Not in everybody, but commonly, and more than half the people with memory problems. And so the person is just not keeping track of the trouble they're having day to day. But the family members are, you know, paying attention. If they're paying attention, they see, boy, this is starting to happen a lot, and the person's not aware of it. So the family's more aware, and they may talk to their loved one about it, and they say, you know, I've noticed you've been repeating yourself. And they say, I'm not repeating myself. And that could either be due to the fact that they're not aware of it, or they may not want to acknowledge it.
I was so adamant about what was happening to Daryl. I wasn't sure. I didn't know. And this wasn't the person that I know. This wasn't the person. Daryl was my husband was very, he always had to be building or designing or working with his hands. And it was getting to the point where he wasn't, and he was becoming very frustrated when he was forgetting to do things or go places.
If you continue to observe these changes, it's critical that you plan to take the next step and have a conversation with the person or others close to him or her about what you've noticed. This can be a difficult or uncomfortable conversation to have. The Alzheimer's Association has developed a roadmap of 10 helpful steps to help make addressing memory concerns less daunting and more productive. So let's take a look. So start by assessing the situation. What changes in memory, thinking, or behavior do you see? What is the person doing or not doing that's causing concern? Next, what else might be going on? Various conditions can cause changes in memory, thinking, and behavior. Are there other health or lifestyle issues that could be contributing to these changes, such as stress or diabetes or change in medication? Learn about the signs and the benefits of early diagnosis. You've already taken this very important first step by joining us for this program today to learn about these topics. So do you notice any of these signs in the person you're concerned about? Has anyone else noticed the changes that you've observed? Talk with friends and family. What, if any, changes have they noticed? Next, prepare to have a conversation. Who should be the one to discuss concerns with the person? It could be you, it could be a trusted family member or friend, or a combination. It's usually best to speak one-on-one so that the person doesn't feel threatened or ambushed, but use what you know about the person to judge what approach might work best. When and where should the conversation be held? It's important to have the conversation as soon as possible. In addition to identifying a date and time, you should also consider where the person will feel most comfortable. What will you or the person having the conversation say? You may want to build out somewhat of a script. Consider the following questions. For example, I've noticed that you're no longer reading your book, and I'm concerned. Have you noticed this? Are you worried? Or here's a question. How have you been feeling lately? You haven't seemed like yourself. Another possible question. I noticed that you put the coffee pot in the refrigerator and it worried me. Has anything else like that happened? Those are just examples, but use what you've observed to use as an example, gently as an example. And offer to go with the person to the doctor. This is especially important for the doctor as well, because they'll rely on other family members or attendants to answer questions, possibly. Ask the person to see a doctor and offer to accompany them. Try using encouraging words such as, you know, there are lots of things that could be causing this. Let's see if the doctor can help us figure out what's going on. Or something like this. The sooner we know what's causing these problems, the sooner we can address it. And I think it would give us both peace of mind if we talk to a doctor. So those are just a few examples of how to approach the person. If needed, have multiple conversations. Don't be discouraged if the first conversation is not as successful as you'd hoped. Write down notes about how it went so that you can prepare for any future conversations. And don't dismiss the changes you're noticing simply because the person is reluctant to address them or the conversation didn't go as planned. In other words, don't give up. And lastly, reach out for support. You can turn to the Alzheimer's Association. You can call our free 24/7 helpline, and we'll give you that information toward the end of the program here. But it's available 24/7, 365 days a week, and you can talk with a master's level clinician who can provide reliable support and expert information, including about how to have this important conversation. So don't hesitate to use our helpline as you see fit. And finally, see a doctor. Most people address concerns about memory, thinking, and behavior with their primary care physician first. However, in some cases, the primary care doctor may refer the person to a specialist for further evaluation. In fact, frequently that is done. And examples of these specialists are listed here. You know, geriatricians have additional training in medical care for diseases and conditions common among older adults, generally over the age of 65. Neurologists, they specialize in diseases of the brain and nervous system, although not all neurologists specialize in Alzheimer's or other dementias. Neuropsychologists can assess, diagnose, and treat psychological disorders associated with brain-based conditions. Psychiatrists can help with disorders that affect mood or the way the mind actually works. Psychologists have special training in testing memory and other mental functions. And I'll even add one more here, which is pharmacologists who can help determine whether use of multiple medications that someone might be taking are having any deleterious effects or side effects that could be causing symptoms similar to dementia. So we now know what signs to look for and how to approach the conversation. Now, so now let's discuss the benefits of early detection. But I'd like first to see if there's any pending questions out there based on that, having that conversation that we just discussed.
Are there any questions that any of you have, please? And also you will see that Grace put the 800 number, the 24/7 helpline 800 number inside the chat. So you could please write that down for yourselves. So in case you come across a relative or friend or see some of these things within yourself, you can reach out to get help. It's okay to get help. So please jot down the 24/7 helpline number. Thank you, Grace, for that.
Thanks, Veronica. And that number will appear on a slide toward the end of the program as well, in case you miss it here. Okay, so the benefits of early detection. Let's hear Dr. Drew.
There are a number of benefits in early detection of Alzheimer's. For one thing, a person is able to have a voice in what happens next. They can make plans. They can live life more on their own terms. They can also make plans for the future, financial plans, care plans. They can let people know what they want, which can be a real gift later on. It also allows time for families to make plans and to make decisions about who can do what and figure out care and those kinds of issues. Also, the treatments that are available for Alzheimer's don't cure Alzheimer's. They don't slow down the disease, but they do help with symptoms. And it seems as though they tend to work better the earlier a person is able to use those. So that can help too. Some people are interested in clinical trials. Clinical trials allow people to have access to treatments that aren't available yet. And for some people, that can be a really important thing to pursue.
So paying attention to, this is just a recap of what Ruth just had to say, but paying attention to changes you notice in people, especially regarding memory, thinking, or behavior, is important for this early detection. If you do observe unusual behaviors or occurrences, take action by having a conversation about what you've observed and consider using those 10 steps to approach memory concerns that we just discussed as a good guide for this conversation. And just customize it so that you are approaching the person in the most supportive and reassuring way possible. There are a number of benefits to early detection, such as planning for the future, access to treatments for symptoms, and participation in clinical studies. So in this next module, we'll talk about seeking a diagnosis. Let's take a look at what may be involved in the medical process to determine the cause of symptoms. Let's start by a quick test of your knowledge here. And you can enter your answer. This is a true and false question. You can enter your answer in the chat room or chat box, and then I will ask Veronica to read out a couple of the answers. So here's the question. Who here thinks that there is currently no way to diagnose Alzheimer's or dementia? Is that true or false? I'll wait a few seconds to let you enter before I give the answer. And I know we've got a smart group here, so I expect a lot of correct answers.
Please put your answers inside the chat box, please. Don't be scared.
We getting any responses, Veronica?
No, I'm not getting any responses.
Well, then I'm gonna assume that you guys are so confused, I'll have to give you the answer. The answer is false. Contrary to an outdated belief that an Alzheimer's diagnosis can only be made at autopsy, there are a number of assessments and tests that make it possible for healthcare professionals to diagnose Alzheimer's and other dementias with a high degree of certainty. However, determining the cause of dementia can sometimes be more difficult. So here we're going to explore possible steps of the diagnostic process. Keep in mind as we review these steps that not everyone may be asked to undergo each one by their doctor. And there's nothing real surprising here, but the assessments will include things like a complete medical history, certainly a thorough physical exam, screening for depression, because sometimes dementia and depression have very similar symptoms. And interview, this is critical, interview with close companions. The kinds of tests you would be getting would be your typical laboratory test, blood, urine, and so forth. A very important mental cognitive status test. There's a standardized test that's delivered, and it's delivered in at periodic times to measure the difference between, you know, the earlier test and the later test. And then brain imaging, such as MRI or CAT scan. Mary's daughters, we're back to the Garcias here, but Mary's daughters are preparing for answers about their mom's changes in behavior. They wonder, do dementia-like symptoms always result in a diagnosis of Alzheimer's or another dementia? Let's see what they say. So they've started the process. They're waiting for some test results, but so far the appointments are going well, and we'll hear what Dr. Salloway says.
Someone could have high blood pressure that's out of control, or they might have a thyroid condition that's not regulated, or diabetes that's not right, or on a medication that actually can cause memory loss. Drinking too much alcohol can make memory worse. So there are a lot of factors that go into cognitive difficulty with aging that some of them can be remedied. And so we want to do everything we can to improve cognitive ability and quality of life.
So I'd like to add here, Annabelle said no. So you were correct, Annabelle. It is not, the response was no. There are other ways to diagnose. You are correct.
Yep. Very good. So just a quick recap here on the diagnosis section, and the diagnostic process will vary from person to person depending on an individual's specific situation and what the doctor feels is the right course of action for that person. The diagnosis may be something other than Alzheimer's or another dementia. which is why it's important to investigate the cause of the symptoms. Unfortunately, stigma and misconception about Alzheimer's, such as, well, nothing can be done, can deter some people from seeking a diagnosis. And getting information and support is also a critical next step. Let's learn a little more about what the Alzheimer's Association offers. So if the diagnosis is Alzheimer's, what's next? Let's see what Patricia and Lydia, Mary's daughters, do. So they now have a diagnosis, and they now are in that position of saying, now what? What do we do now? And their doctor did recommend them to the Alzheimer's Association. So let's see what resources and support is available through the association. The Alzheimer's Association is in communities across the country, even in different places throughout the world, providing direct service to individuals and families facing this disease. Our mission is to eliminate Alzheimer's disease through the advancement of research to provide and enhance care and support for all affected, and to reduce the risk of dementia through the promotion of brain health. Our vision is a world without Alzheimer's disease and all other dementia. The association is available wherever and whenever you need reliable information and support. 3 of our key resources are listed on this slide, and these can connect you to information and support, which includes that all-important helpline that we've talked about already. It's 800-272-3900. Call anytime, day or night, to receive information and support. This provides access to highly trained and knowledgeable staff who can help with education, decision-making support, crisis assistance, and resource identification. This is not like a call center. This is a true helpline with experienced professionals. Master's level clinicians are available around the clock to provide in-depth care consultations, a free of charge care navigation service offered to families at any stage of the disease, and help is available in more than 200 languages. We're going to hear from Tim. Tim is a care partner who has called the helpline for support. And I really identify with this gentleman because I found similar experience.
I've had a couple of phone calls that I've been able to make in to the call center when I've had a couple of quick questions that I wanted to ask. You know, there's been a couple of nights, 2 o'clock in the morning, you have questions, you have anxieties, and I was struggling dealing with them, and it's amazing. It was one of the best things I ever did, was keeping the call center on my favorites now. Just to know that there's somebody you can call who is aware of what you're going through.
So our next key resource is our website here at alz.org. This is often the first stop for individuals following a diagnosis of Alzheimer's or another dementia. It includes sections specifically for people living with the disease and caregivers. And I encourage you to explore that website. It's a very robust website with a lot of good information. So if you're interested, that's a good place to look around. We're going to hear from Teresa, who is living with Alzheimer's, about what questions she had and the information she found on alz.org.
When I went to the Alzheimer's Association website, which is alz.org, there I was trying to find out more about what was Alzheimer's, what really is this disease, what is younger onset Alzheimer's, what is dementia, is there a cure, how long has this been around, how many people are affected by this, where can I go for resources, where can I go for help, what do I do with this? How can I handle this? Is there more people like me out there? Is there someone that I can talk to if I need to? And there I found a support line that's 24 hours a day. And there I found where I can go for workshops, where I can go and read things and postings that people have done, where I can find out what events is happening in the Alzheimer's Association, where I can see how it's affecting people around the globe.
Our third key resource is our Community Resource Finder, and this is a wealth of community-based resources available in your area, including long-term care and community-based services, local association offices and their offerings of programs and support services. And if you're concerned or helping someone in a different part of the country, you can find the local office through the website, look up and see what resources might be available in that person's area, whether it's transportation or food delivery or long-term care, adult day health centers, things like that. So there's just a plethora of resources available in communities. We just need to know how to tap into them. And this is a good place to do that. We'll now hear from Tom, who is also living with Alzheimer's, and he shares his experience seeking help from this resource here, the CRF.
Since I've been diagnosed with dementia, the one place that I know I can go to for assistance and help and support is to the Alzheimer's Association. There are people there that I know by name that I can contact if I'm having a difficult time or if I'm struggling to find some resource, that they will provide that to me.
So now that we've taken a basic look at Alzheimer's disease and what resources are available, let's talk about how you can take action if you're so inclined. There are many ways through the association. You can volunteer, whether you can spare a few hours a week or make a more significant time commitment, consider volunteering with the Alzheimer's Association. Numerous opportunities are available, including becoming a community educator or joining your local walk planning committee. The annual walk is our biggest fundraiser. And you can visit our website /volunteer to learn more. Advocacy is a major effort with the Alzheimer's Association. You can become an Alzheimer's Association advocate and speak out on behalf of the needs and rights of those facing Alzheimer's disease. This entails sometimes going right to the state legislature or to our federal Congress and lobbying or influencing our representatives who may be on one side or the other of increased funding for Alzheimer's research and support for families. Trial match. Everyone can help advance Alzheimer's research by participating in clinical trials. You can get started with the Alzheimer's Association Trial Match, which is a free, easy to use clinical studies matching service, which will connect you with a study that makes sense for your situation. And then we have our Walk to End Alzheimer's, which I just mentioned. You can form or join a team for the Alzheimer's Association Walk to End Alzheimer's and raise critical funds and awareness. Held annually in more than 600 communities nationwide, Walk to End Alzheimer's is the world's largest fundraiser for Alzheimer's care, support, and research. Now, because of the year of COVID and pandemic, we had to find imaginative ways to do the walk in a public setting, but people came through and did what they could in different ways to keep the fundraising going. So that's an important event every year. Well, that concludes today's program, and I will open it up now for any questions, comments, discussion, or whatever you'll have. Thank you. I'm going to stop sharing my screen at this point, and we'll go back to the Zoom view.
Were there any questions? First, we want to thank Jean for this awesome presentation. It was very, very informative. It went from A to Z. It shared a lot of knowledge that I did not know, and I'm sure many of you did not know. So yes, we thank Jean as well as Grace for allowing this forum to happen. So if you had any questions, please unmute yourselves and please feel free to ask.
I do have a question. I have a question about diet. I see a lot of advertisements on TV. They're talking about India. Means I would like to know what can I do on my diet that is going to help me.
Did you say your diet?
Yes, they're promoting many products on TV. I hear a lot about things that we should be taking. I don't know.
Well, before I answer you specifically, I'll just say that one of the programs that the Alzheimer's Association presents and that I personally present is called Healthy Living for Your Brain and Body. And we talk a lot about nutrition in that program, as well as exercise, social engagement, and cognitive exercises. So, but the research in recent years has focused quite a bit on healthy lifestyle as a way to either prevent or at least slow down and minimize the disease, possibly, and finding things that we all kind of know, which is to avoid, you know, trans fats, avoid too much sugar and processed foods, and stick with a couple diets like the Mediterranean diet or the DASH diet. So the other part of your question had to do with supplements or vitamins or products that we see advertised. The only thing I'll say about that is that unlike medications or drugs, supplements and vitamins are not held to the same rigorous standards for efficacy that drugs are through the Federal Drug Administration. So one we see a lot on TV, not to pick on anyone in particular, is Prevagen. Well, we hear anecdotal evidence about how it's helpful for people, but there really are no major studies done under clinical requirements and so forth to determine, in fact, what about Prevagen or a supplement is actually working and why. So I would caution you to do a little more research about a particular product. Certainly discuss anything like that with your doctor before you start taking an excessive amount of vitamins or nutrient supplements. It's always best to clear that with your doctor, because they all are made with a certain amount of chemicals and ingredients that could interact with other things you're doing. So that's a long-winded answer, but hopefully it helps.
And if I may jump in here, so doctors say that if they could bottle the effects of physical exercise, if they could put the effects of physical exercise into a pill, it would be the most effective treatment and risk reduction, supplement, quote unquote, out there. So what is healthy for your heart is healthy for your brain. So getting that cardio exercise in, or any sort of exercise, is better than no exercise, but cardio exercise is the best for reducing your risk of dementia. And like Jean said, a heart healthy diet like the DASH diet and Mediterranean diet is really much better than, and much less costly than any of these, supplements promoted on TV.
Thank you, Grace.
Any other questions?
How do you feel about the senior center testing for people who may have concerns about Alzheimer's? I notice it when I go to the senior center. Can you hear me?
Yes.
Okay, because I know my picture doesn't show, but that's okay. I can
That's
see you.
okay. I'm not sure what kind of testing that is. It the standardized psychological test that's often given to people, or is it in keeping with some of the warning signs we just talked about? I'm not sure what that testing is.
Well, I'm not sure either. I think I kind of wanted to stay away from it, just for thinking, oh my gosh, maybe I do have more seriousness. We all are questioning ourselves as we get older, and, there are things that you forget, and then, hey, I balanced my checkbook fine and this and that. But you know what? Every situation I think is different, but they do have them where it's a little screening test, and honestly, I don't know what it involves.
And may I ask who is offering the test? Who performs the test?
This is just done with the seniors, like the Martinez Senior Center, and then the Pleasant Hill Senior Center, and they have like a once a week where they have a little testing. And I was wondering who helped.
I mean, I would.
And I'm sure if they had questions, they'd probably refer you to a doctor or your family doctor,
I think it depends who is performing the test. One needs to be trained to perform the test, right? So medical personnel, some social workers like myself, we've been trained to perform the test. And then, how does one deliver the results and deal with, what happens if you find, the person has a lot of cognitive impairment. So I would be careful about those tests being offered by the seniors. And if you have concerns, to go, again, talk to your primary care doctor. And even primary care doctors aren't fully trained to diagnose Alzheimer's and dementia. And like the slide that Jean showed, that this primary care doctor is a starting place. But you should actually be asking them for a referral to a neurologist or a neuropsychologist or a psychiatrist or a geriatrician.
And then I'd like to add to that. I guess the concern for me in hearing you say that is if they are not trained and they're not working within a clinical scope of practice, that can be creating more problems. That can be very problematic. And I'm saying that from the lens of being a doctoral student of clinical psychology who's gone through a neuropsychological series and has done the batteries to train for cognitive decline, dementia, Alzheimer's under a licensed neuropsychologist. This is not something that you can just simply give like a 21 a page 21 questions there and you answer them and I give a diagnosis or tell you there looks like there's a problem. That's I would say you're kind of going through muddy waters there. So if you feel like there is a problem, or if you feel like a family member or friend has a problem, first go to your primary care physician, just as been suggested, and ask them to just directly refer you to a neuropsychologist or a neurologist or a psychiatrist or a clinical psychologist, because we are trained. There's certain things that we have to do within the state of California and other states to show that we're certified and we can go forward. So this is not something where we give you a page with 21 questions and you fill it out and we say, bam, there's a problem. It doesn't work like that, because that can do more damage. And then who's gonna come in after the damage is done to help ratify the situation? So like yourself, I'm concerned and I'm very leery about that. And I'm just kind of wondering, how are they able to do that and get away with, unless they are master's level or doctoral level persons that are doing it. And then what are they doing with the data? Who's seeing the data? because then you have limits of confidentiality that comes to play. There's privacy, HIPAA laws and regulations that we all are governed under. So it evokes a lot of questions from my lens.
Thank you.
No, thank you for putting that out there because that's concerning.
Any other questions?
Let me just add also one other program that we deliver is called, and this is especially helpful for people in the caregiving role. It's called Effective Communication Strategies in working with someone who has dementia, because it can be quite challenging to effectively communicate with. I learned the hard way in many cases how to control my behavior when getting frustrated, for example, when hearing the same question over and over, or when confusion becomes increasingly difficult to manage. So that's another helpful class. And another one that I also present and that the Alzheimer's Association has is just the basic understanding Alzheimer's and dementia. It goes into a little more detail about the specifics and some of the medications that are used to treat symptoms. They don't slow it down, they don't cure the disease, but in some people and some of the time they do help with the symptoms of memory or confusion.
Do you have a phone number for that, Effective Communication Services?
That's actually a program like the one I'm teaching now. It's part of the core curriculum, and you can tap into the local Alzheimer's office to get the schedule, or maybe Grace can comment on that.
Yeah, we offer all of these classes that Jean has mentioned and more on a monthly basis. So if you're interested in the effective communication class, just call the helpline. Again, 800-272-3900, and they can look up when the next class is. It's all on Zoom right now, so you can attend one that's offered anywhere in the country. And yeah, so that's the best way to do it.
Thank you.
Okay, so is there anything else? Any more questions? Any more comments? No? Well, again, we'd like to thank Jean and Grace for allowing us the opportunity to have this awesome information shared in this setting. So if there's nothing else, we'll thank each of you again for attending, and we will say, go and enjoy the rest of your day and the rest of your week. And look out for the power